Hey everybody, it's Dr. Mark Technowski again with True Sport Care. We're going to go over our true-false questionnaire. Hopefully you've seen this already, you've tried to answer the questions. If you're a good true and false test taker, you probably did okay. But let's go over the answers and let's explain to you why we feel the way we feel. All right, so question number one. Pain is the only indication of imbalance in the athlete body. Pain is usually the driving force as to why a patient will seek out our care, but it's not necessarily the only indicator of dysfunction. We went through our athlete checklist and you can see that there are a lot of things that would indicate a possible imbalance in the body. Some of them are not yet pain, but they could be tightness, they could be weakness, and they could be the perception of not having the same coordination on one side, the same balance on one side as the other side. So these are all things that we look for when it comes to imbalances in the athlete body. So the answer to question one is false. Question two, athlete preparation and recovery is the most important part of an injury prevention program. We happen to believe that this is true. It is said that athletes these days are too specific. They are doing too much of the same thing. They're either playing lacrosse or they're doing lacrosse type speed and agility, and they're not diversifying their body movements. And although this is true, I think that there's one more recourse that we can essentially take in order to try to prevent all of these injuries from happening. And this is from my experience working with professional and Olympic athletes, is that if they compete for 2 hours, 3 hours, and then they have their training and they have their practice, they spend a lot of time preparing their bodies. So they prepare their bodies for competition. After they compete, they're going to be spending hours upon hours recovering, and that's going to include massage therapy, physical therapy, chiropractic, acupuncture, hot tub, cold tub, foam rolling, stick rolling, ball rolling, stretching, etc., etc. And the difference is that our kids here, high school kids, middle school kids, after they're done competing, they go home and they have to do their homework and they don't spend the time on the recovery. So I do think that there is a little bit too much specificity when it comes to body movements, but I also think that we should be encouraging the athlete to spend more time on preparation and recovery. So the answer to question two, we believe, is true. Question three, tight muscles are acceptable if it is an inherited trait. This is an interesting question because a lot of times an athlete or a patient will just say that, well, you know, my mom has tight hamstrings, so therefore I am allowed to have tight hamstrings too. And we don't believe that at all. We do believe that those patterns may have been passed down from generation to generation, but it doesn't necessarily mean that you are relegated to a life of tight hamstrings. It means that there's a good reason as to why that tightness is there. Our docs here at True Sport Care are excellent at figuring out why those hamstrings are tight and correcting that issue, teaching you why it's happening, so that way you will have good tools in order to reverse that progression. All right, so tight muscles are acceptable if it's an inherited trait. Question three, the answer is false. Question four, better athletes typically have less imbalances and less dysfunction. That couldn't be more false. The problem is that better athletes just have better programs or better ways to figure out how to work around some dysfunctional muscles. So a good example is a professional, let's say, running back. They may have 500 patterns in their brain of how to get down that field depending on what's thrown at them. An average person may have 20 patterns. So because of certain types of muscle dysfunctions, you may have to work around certain underperforming muscles. If you take away 18 of those patterns to run down the field, the average person has 2 patterns left. They're not going to be able to figure it out. Take away 18 patterns from the guy who's got 500 patterns and they still have quite a few patterns. So I did hear this one time spoken by a therapist, and they said that the more athletic somebody is, the more they are able to mask their dysfunctions. So just because you're a good athlete doesn't mean you don't have dysfunctions. It just means that you know how to work around them. So better athletes typically have less imbalances and dysfunction. That is absolutely false. Question five, attention to proper form and technique guarantees the proper utilization of target muscles. Now you see I use a lot of words like guarantee, best, worst, never, always. Those are really good questions when you're taking a true and false test. So you can probably guess that this one is also going to be false, because just because you're paying attention to proper technique, it absolutely does not guarantee that you're going to be using the right muscles. We see it all the time when patients come in and they demonstrate for us a perfect deadlift. I say, where do you feel it? And they say, I feel it in my back. I say, that means it's not a perfect deadlift. So rather than it looking perfect, we always want it, and we require our patients to make sure that they feel it perfectly. That is absolutely more important than making it look like it's perfect. I always give the analogy, let's take 100 people, put them on a lat pull-down machine. If we have them do 10 sets to failure, and then in a few days when delayed onset muscle soreness kicks in, we ask them, where do you feel sore? Not everybody says their lats, and this was with proper coaching. So we can make the assumption that not everybody will use their bodies the same way. You have to feel it perfectly rather than just make it look like it's perfect. Number 6, rest is the best recommendation for an overuse diagnosis. This is done over and over and over again by medical professionals and lay people alike. They say, well, if it's an overuse, then I just want you to rest. And you know what that does is it makes the symptoms go away. But I'll ask you the question, logically, does that fix how it happened in the first place? No, you didn't do any types of corrections. All you did was you let the body heal. And that's great, but why did the body get injured in the first place? And that's what we always try to ask. So whatever the climate was for that particular overuse, quote unquote, injury to occur, that didn't change. So if the person after resting goes back to that activity that was creating the issue in the first place and they didn't change how they were using their body, my guess is that that overuse issue will come back, and that is what we hear time and time again. The person didn't change how they used their body. The problem, maybe it took a couple of weeks, but the problem, the overuse problem, did come back. So that question was, rest is the best recommendation for an overuse diagnosis? False, absolutely false. Number 7, learning the official medical diagnosis helps to effectively treat a condition. This is something that athletes and patients are perpetually looking for. They're looking for a diagnosis. So if somebody comes to me and they go, I have plantar fasciitis, then I go, okay, great. So I know that you have pain in your foot. But does that help me effectively treat the condition? Now realize, I might be parsing words a little bit, but I can effectively treat somebody's symptoms if I know what their diagnosis happens to be, but it absolutely in no way helps me treat their condition, because we've seen a plantar fasciitis come from tight calves. We've seen a plantar fasciitis come from weak glutes. We've seen underperforming toe flexors, overperforming anterior chain hip flexors on the opposite side. So how can you effectively treat something just because you know it's a plantar fasciitis? I don't care actually what it's called, and most of the docs here do not really care what stuff is called. We care how it got there, because if I know how it got there, we can reverse it. We can completely teach the patient to say, listen, it was because of this weakness or this tightness. And if we can fix that, the problem goes away, and it goes away permanently. If you're treating only symptoms, just like rest, you may make it feel better for the time being, but in no way will you make it feel better permanently. So again, number 7, learning the official medical diagnosis helps to effectively treat a condition. Nope, absolutely not. That is false. Number 8, deadlifting should be avoided by back patients and the elderly. This is a loaded question. The answer is false. The answer is 100% false. We get grandmothers deadlifting and squatting. We have back patients deadlifting and squatting. And you know why we do that? Because if your grandmother ever travels to visit her family and she has to lift a 40-pound suitcase, then you know what? She's deadlifting. If your grandfather ever has to get his butt up out of a chair, then he's technically squatting. So these deadlifts and these squats are functional movements that all of us have to perform on a daily basis. So if we're not training these particular movements, then how do we expect our elderly patients and our back pain patients to do them successfully? If you avoid these triggers, then they will always be triggers. If you find out why this trigger is a trigger, fix that issue, then the triggers are no longer triggers, and you can pretty much live your life without having to think about those things, or oh, I can't do that, or oh, I can't do that. That's not how we want people to live their lives. So deadlifting should absolutely not be avoided by anybody. They should learn how to do it properly. So number 8 is also false. Number 9, treating the site of pain is the most effective way to treat the cause of a condition. This is essentially like question number 7, because again, if somebody has an epicondylosis, or if they have a tendinosis, tendinitis, It doesn't really matter what type of osis or itis it is. It essentially is just telling me this is where the symptoms are and this is what's happening in that particular area. But the least, and I will repeat this, is that the least effective practitioners are the ones who only treat the site of pain. I'm going to say it again because it's that important. The least effective practitioners are the ones who only treat the site of pain. They may make you feel better for the time being, but in no way will they reverse the condition, and in no way will you have a permanent result from that. Think about the patients who go for 3 months of physical therapy. They feel great when they're immediately done, but a couple of weeks after, 3 weeks, a month afterwards, my symptoms started to come back. So what actually did change? Did anybody fix anything? Did anybody teach you how to make these symptoms not come back? I don't like that type of response. I don't like that type of result. We expect that when patients are done with the condition that they came in for, we don't want them coming back in for that same condition. If they do come back for that same condition, one of two things happen. They either didn't continue with any of the home exercise program that we gave them, or we didn't find the right combination of muscles to give them. All right, number 9. That's the one we just did. Treating the site of pain is the most effective way to treat a condition. That is false. Number 10, glute bridging will always target and build the glutes. This harkens back to the thing we talked about with the lats. The answer to this question is false. I see people doing glute bridges all the time, and it looks like they're doing it perfectly. But I ask them, where do you feel it? And they will say, I feel it in my back, or I feel it in my hamstrings, or I feel it in my calves. So if that's the case, then guess what? Your glute bridge is not technically a glute bridge, and it is more of a back bridge, or a hamstring bridge, or a calf bridge. But it matters not if it looks perfect, but it matters if it feels perfect. So number 10 is also false. I hope you did well on our quiz. If you have any questions, please feel free to email at the below listed email. We'd be more than happy to check it out, answer your questions, and if you're interested in getting yourself analyzed, come into the office and we'll see if we can make you a better athlete. All right, thanks very much.